Hi guys, welcome back to Rosem React, where we break it down and keep it real. Let's get into it.
This Medicaid cut is going to be absolutely devastating, guys. Rural hospitals all across the country are already on life support, and this bill is basically pulling the plug. They are not just trimming around the edges. They're gutting Medicaid funding, and rural hospitals rely heavily on Medicaid reimbursements just to survive. It's not just for people who are on Medicaid. These cuts affect everyone, because when a hospital shuts down, it shuts down for everyone. Doesn't matter if you've got private insurance, Medicare, or nothing at all. If the ER is gone, it's gone. In Nebraska, there's already a rural hospital planning to close, and they're being honest about why. It's because of these anticipated federal cuts, and it's not just one. Over 100 rural hospitals have already shut down in the past decade, and hundreds more are on the brink. This bill could push dozens, maybe even hundreds over the edge. And people don't realize how much damage this does to a town. The hospital's not just a place for emergency, guys. It's where babies are born. It's where cancer gets caught early. It's where your kid goes when they break their arm. It's one of the biggest local employers. It supports pharmacies, nursing homes, ambulance services. When a hospital closes, the entire local economy takes a hit.
Yeah, Trump's bill that's about to pass the House is going to cut Medicaid, but I'm not on Medicaid, so why should I care? I would love to get on here and explain to you all the reasons why you should care about other people, low-income people losing their health insurance by Trump's Medicaid cuts. But you don't care. You don't care. I want you to care, but you don't care. What you care about is how Medicaid cuts would hurt you. So that's what I'm going to do. I'm going to explain to you how Medicaid being cut is going to be bad for you, a person who's not even on it. Okay? All right. Stay with me. I'm going to go real slow. When uninsured people go to the hospital and they can't pay, but they go to the emergency room anyway because they're about to die for some reason, and they can't pay, hospitals and providers eat those costs. It's called uncompensated care. Those losses that the hospitals just ate and the providers ate are oftentimes passed on to privately insured patients by way of higher prices and higher insurance premiums. That's you! You see how we got to you? Do you see how you're in it now? So by covering low-income individuals through Medicaid, the same Medicaid that Trump is trying to cut, it lessens those uncompensated costs, which keeps your premiums down. You see?
So we're already seeing the effects of the bill, and it hasn't even passed yet when it comes to rural hospitals in anticipation to the Medicaid cuts. Curtis Medical Center in rural Nebraska has announced that it's going to be closing, and it does cite the anticipated cuts to Medicaid as one of the reasons they are closing. So this is only the beginning, folks. You can try to sugarcoat it all you want. This is what's going to happen.
Since all these Trump supporters are so happy that the big beautiful bill is going to cut out Medicaid for so many people, I wonder if it's going to take off some of the taxes they pay on their checks. I bet it won't do that, though. They'll take away Medicaid and health care for 16 million people. But I bet they won't stop taking so much out of your check per week or every 2 weeks. You ever thought of that? But Trump's on your side. Look at your check when you get it to see if those cuts they make helps you out when you get paid. You're going to still pay the same amount in taxes, more actually, and they taking Medicaid from people who need it, and food assistance. So when you think your old buddy Trump is doing you a favor, look at your check and how much taxes they taking out of it, and then let me know what you think. How about that?
So how are the Medicaid cuts going to impact Americans? This isn't going to be a right versus left post. You see, if a projected 11 million people are going to lose their health insurance, people can't afford to pay out of pocket to go to the doctor, even to an urgent care. That all adds up, and they're going to wait. Many will wait till a certain point where they're going to have to then go to an ER. And when people start having to go to the ER, the ER is crazy expensive. It's insane what they charge. So the hospital is going to have to eat that. They're going to pass that expense on to the private insurance, on to the people who are paying. So ultimately what you're going to see is you're going to see the price of healthcare go up, because less reimbursement means hiring freezes, potentially layoffs, and therefore the care that you're seeking when you're really ill, you're going to be waiting a long time for. And let's face it, you guys wait a while now. And because rural hospitals rely so much on Medicaid, you're going to see hundreds of rural hospitals close. So where are they going to go? Those patients are going to go to your hospital. But it won't just stop there. When hospitals need to start charging higher prices to make up for the reimbursement they're no longer getting from the people who were on Medicaid previously, you're going to end up seeing your premiums go up.
So the so-called one big beautiful bill has passed. And let me tell you, it's only beautiful if you are rich and disconnected from reality. For the rest of the country, especially the poor and the working class, it's nothing but disaster wrapped in a shiny language. And one of the biggest punches in this bill is the massive cuts to Medicaid. Yes, you heard that right. Medicaid, the very thing millions of Americans rely on for healthcare, is being gutted. The bill makes it harder to qualify, slashes funding to the states, and quietly removes protections that have been helped low-income families, seniors, and people with disabilities survive. Let's dive into it. If you're coming across this channel for the first time, my name is Rosem. Kindly consider subscribing, give this video a thumbs up, and let me know your thoughts in the comment section below. Let me play a few clips on the same, and I'll be back with my commentary. All credit goes to the original creators of this video.
Whole community suffers. And let's be clear, this is not just about weeding out undeserving people. That is bullshit. These cuts hit working families, elderly folks, people with disabilities, veterans, kids. And even if you don't have Medicaid, your hospital might still close down because it can't survive without that funding. This is what happens when you let politicians treat human lives like budget lines. They're not just cutting costs, they're cutting access, cutting jobs, cutting lives short. People are going to die because they won't be able to get help in time. That's not dramatic, that is reality. And pretending it's anything else is just cowardly and ridiculous. And yeah, this bill might pass in the next day or two, but we better remember every single fucking name that signed off on it, because once these hospitals are gone, they're not coming back, and neither should the people who voted to let it happen.
See that? This is about you. We don't even have to have a bleeding heart. We don't have to care about everybody else out there. We can just care about ourselves and still fight against these Medicaid cuts. And this is not just my opinion. The Kaiser Family Foundation did an entire study that showed that Medicaid expanding Medicaid in states, lowers hospitals' uncompensated care by 25 to 40%, depending on the state, which eases the financial pressure on the entire healthcare system. That's you. You're in that too. Medicaid is also just preventative. It being in your state prevents things that happen that would exhaust your healthcare system that you would have to pay for. Lutheran Services of America is a very good example of that. The people who get Medicaid through them get all this preventative care, and they get care coordination and in-home support, and it improves the health of the people who are on it, and it reduces their need for high-cost healthcare services, right? And so then those members remain healthy, and they end up participating members of the economies around them. Like, it's just a good thing to have in your state economically. So look, the big, beautiful bill that wants to cut this, Trump's bill that wants to cut this, has already passed the Senate. We're in the final hours. We have like a day. You have to call your representatives. You have to tell them not to make these cuts to Medicaid, right? That people need them, that even if you're not on them, that they help your local economies as well. Find whoever your representatives are at the federal level. Find your representative, email them, call them, do whatever you can. You literally have a day. I did it earlier today to tell them, urge them to vote against something that's not just going to hurt the people around you. It would hurt you, whether you're on Medicaid or not. Okay? All right.
Now people are starting to realize what's happening. Folks who thought they were safe are getting letters saying they have been dropped. Clinics are turning patients away. Prescription prices are going up. Mental health services are vanishing. And the rural hospitals, some are on the verge of closing altogether. All because the government decided the rich needed another tax break and the poor could just quote-unquote figure it out. And here's where it gets even more ironic. Many of the people hurt by this voted for the politicians who pushed this bill. They were promised less government, more freedom, and draining the soul. But instead of draining anything, they just redirected the suffering. And now people are waking up to a hard truth. You can't eat slogans. You can't treat illness with patriotism. And you can't go to the hospital with no coverage. A lot of rural Americans, especially in red states, are being hit hardest. These are areas that already had fewer doctors, fewer clinics, and more health problems. Medicaid was a lifeline. Now that lifeline is being cut, guess what? There is no backup plan, no magical solution, just more bills, more pain, and more people left behind. And let's talk about the politicians. They are out there celebrating, holding press conferences, smiling for cameras, talking about fiscal responsibility and freedom from dependency. Meanwhile, single mothers are wondering how they will afford their child's insulin. Veterans are losing access to therapy. Seniors are being told to choose between food and medication. What's even more disturbing is the silence. Where is the outreach? Where is the national conversation? It's like people are so used to being hurt by the system that they have gone so numb. But this is not normal. It shouldn't be okay for the government to take healthcare from the poor just to reward the rich. It's not just undocumented immigrants being affected. This is not about others. This is about your neighbor, your grandma, your co-worker, your child's teacher. Medicaid serves millions of everyday Americans, and now many of them are being told they don't matter. And to those who are saying that, well, people should just get private insurance, let me explain something. Private insurance is expensive and not everyone qualifies. Medicaid exists because some people can't afford any other option. Telling someone to just get a job with benefits ignores the reality of low-wage work, unemployment, chronic illness, and caregiving. Life is not that simple. This bill didn't just cut Medicaid, it did cut home. It sent a message loud and clear. If you're not worthy, you are disposable. If you're struggling, it's your fault. If you get sick, you better pray, not for healing, but pray for mercy. And here's the scariest part. This is just the beginning. Once they get away with cutting Medicaid, what's next? SNAP, disability benefits, housing support, social security? Because if they can take away one safety net down, they can take them all. So what can people do now? First, wake up. Understand what's really happening. This is not just about politics, it's about survival. Second, speak up. Call your representative. Share stories and help your community. Support clinics, donate to aid groups, and check on people around you. Because you can't wait for politicians to care. You have to care for each other. To those who supported this bill and are now shocked by the results, maybe now you'll listen. People trying to warn you. Healthcare is not a luxury. It's a right. And you can't keep voting for people who don't believe that and expect a different outcome. And to the rest, you've got to stay loud. You've got to keep fighting because no one deserves to just die just because they are poor. No one should go bankrupt because they had a stroke or got diagnosed with cancer. And no one should feel like they don't matter just because they need help. Let me know your thoughts in the comment section below. Thanks for watching. I'll see you in the next video.